he's going to get the condition.
Yeah.
That's going to be true no matter what.
Say, I'm sorry, I can't, you're uninsurable. And
He would be uninsurable once he got Wilms tumor, once he got diabetes.
But you don't know when. So maybe they'll get their insurance before they get the problem.
But so do you tell every newborn, go get disability and life insurance for your child? There's a chance they're going to get diabetes or Wilms tumor?
We try to get a long-term disability insurance for our physicians. And we had a physician that had one of these rheumatological illnesses, not sick.
No, I get it. My point is that I understand, but because Nurture doesn't screen for adult onset conditions, it only screens for early childhood conditions.
Right.
You're not going to be in that quandary. We're not looking for BRCA. We're not looking for Parkinson's. We're not looking for Huntington. We're not looking for adult onset conditions. So all of these will have presented by 8, 9 years old. So it's not the only alternative is to tell parents, get life and disability insurance. You can't get disability insurance for a 3-year-old. You know what I mean? You just can't. You can't get life insurance for a 3-year-old, but realistically, they're going to have the condition. It's going to be a part of their life no matter what.
But I wonder, these insurance companies, do they have access to that information? They seem to get access to everything.
I think they would. I think you have to disclose it anyway if you are making application, because if you don't disclose it and then something happens, you void the policy. I think that it would be important to disclose. But I think my point, George, is that from a functional standpoint, it's irrelevant because the conditions are so highly penetrant that by the time the person is actually getting life and disability insurance, they will already have it and will have to report it regardless.
Yes.
It doesn't matter.
It's no different than you can't get homeowners insurance in certain areas of the country because of the amount
But that's a choice.
No, I know, but if your grandmother had that house, it become uninsurable because no one wants to go into the market. They leave the market. And as far as disability, they can disqualify you for disability because we went through a divorce and you became depressed and somebody wrote in the chart that you were depressed post-divorce, and that's it. They don't want to insure you because you're a suicide risk.
Right.
And that's it. So we're never going to win that battle. Insurance is about assessing risk and actuary tables. And if you fall out of the norm,
I agree with George about screening for adult onset conditions. And actually, I discourage patients from screening for certain adult onset conditions because of that. Or I tell families, look, before we're going to do this for this adult onset condition, I want you to think about this issue. And if it isn't affecting your child's health and wellness right now, I think you should wait. And at the point at which they're, whether it's reproductive age or we need to know it for contraceptive use or whatever, then we will consider screening. So I agree with you, George. I'm not disagreeing at all. But I feel like for these particular conditions, because of the early onset of symptoms, it's not going to be as relevant.
Now, Molly, what do you think pediatrics will look like 10 to 15 years from now with all the different I don't know if they're new diseases, but more predominant diseases that we're seeing now that infectious disease is gone?